The Turks and Caicos Islands government recognizes the threat posed by the outbreak of Ebola, this virus disease, in West African countries and other parts of the world, and the negative and detrimental impact that this particular disease outbreak can have on the lives of the citizens of the Turks and Caicos Islands, as well on the economy of the Turks and Caicos Islands, if a case was to be diagnosed here in these islands. To this end, the government has been active in preparing and increasing our capacity in the various public health agencies, the various border control agencies, and the various stakeholders in Turks and Caicos to prevent and detect at the point of entry those persons with the virus or at risk of having the virus from entering these islands. In addition to increasing our capacity to manage such cases in the Turks and Caicos Islands through our various public health and clinical interventions such as surveillance, contact tracing, isolation, quarantine, clinical management of patients, as well as disposal of bodies and Ebola affected or infected biohazardous material, the government, via the Ministry of Health and Human Services, have been engaged and have implemented the following actions over the past several weeks since we've been preparing. We have convened at the highest level the disaster management policy and executive groups, which includes the minister, the premier, and the governor, to consider and decide on major policy options as it relates to Ebola outbreak and the Turks and Caicos Islands preparedness and response actions. We also had consideration at the level of cabinet, where recommendations from the Ministry of Health for increased funding and support for the recruitment of additional staff, materials and supplies, including the personal protective equipment, and to execute all aspects of the Ministry of Health Ebola Action Plan. The consideration of Cabinet and also the decision on the recommendations of the recommendation of the Public and Environmental Health Board to impose a strong travel advisory to persons traveling to West African countries and other Ebola-affected countries, in addition to the development and approval of the public health order under the Public and Environmental Health Ordinance to subject all persons entering into the Turks and Caicos Islands to screening or clinical examination and isolation and quarantine if necessary in the interest of the health of the public. We also engage in education campaign and training of frontline officers at the airports and seaports and other stakeholders, such as those persons in the hotel and tourism sectors. We have also implemented full screening at the Providenciales International Airport using temperature sensors, questionnaires. The latter, which is those questionnaires in the paper form, are to be fully implemented by tomorrow. That will aid in our detection of persons who may be at risk of having Ebola. We have also engaged in the procurement of personal protective equipment to be used by staff at different levels of intervention, those on the front line at the borders, as well as those in the medical room at the airport facilities, those persons using the ambulance services, as well as persons who engage in clinical care from our hospitals. We have also engaged in the procurement and begin in the procurement of the isolation units that will be identified for persons to be isolated and to be treated at our hospital facilities, and also plans for evacuation thereof for persons who may be suspected of having being diagnosed with Ebola. In collaboration with CAFA, the Caribbean Public Health Agency, and PAHO, the development of protocols for the transport of laboratory samples and for the diagnosis of Ebola patients at the Center for Disease Control laboratories in the United States. We have engaged the support of the Pan American Health Organization, who is assisting us with the development of our Ebola preparedness and response plan, and they will be committing to support us for the various elements under that plan, especially if a case of Ebola was to be diagnosed in the Turks and Caicos Islands. And Pan American Health Organization officials have been in the Turks and Caicos Islands for the past week, working with staff at the Ministry of Health, and also because they were instrumental in helping assisting the Bahamas in developing their Ebola response plan, and to do likewise here in the Turks and Caicos Islands. So even though all of these measures have been implemented either in full or in part, I am here to tell the Turks and Caicos public that Turks and Caicos is continuing to prepare itself to respond to the threat of Ebola, and also to deal with any case of Ebola that is diagnosed in the Turks and Caicos Islands. So we are asking all residents and citizens to remain calm. We know that this is an emotional subject, an emotional topic, but we're asking you to remain calm as we use good public health sense, public health knowledge, and also good policy as we deal with this particular issue. We will continue to keep on our radar other interventions that may be necessary based on information, based on our ongoing evaluation of our performance with the various measures that we have put in place thus far. And these may also include looking at how we can enforce the issue of those persons who might have traveled to Ebola-affected countries and might have come into contact with Ebola patients, how we can enforce them staying out of Turks and Caicos in that country for at least 21 days after visiting that country before coming to Turks and Caicos, because it is becoming a challenge for us to be able to monitor all of those individuals who may be affected and to monitor them in isolation. So those are some real issues that we have to take into consideration as we make decisions with regards to whether or not we will step up that control, as well as whether or not travel ban is the answer to which most other Caribbean countries are going. I am sure Dr. Eichemans will tell you here that the World Health Organization, as well as PAHO, as well as the international health regulations, does not support travel ban, but each country reserves the right to make decisions on the various issues that affect those individual countries and their capacity to deal with the threat of Ebola in those countries if they are diagnosed in a particular country. So we in Turks and Caicos are confident at this point in time that we are prepared enough to be able to detect Ebola at our borders, as well as to manage case of Ebola if we were to contract it. But we are not fully prepared in terms of dealing with all aspects of it. I think no country in the world right now is fully prepared to deal with the full impact of Ebola, but we are sufficiently prepared, and we are continuing to prepare ourselves. And that is why we call on the resources of agencies like the Pan American Health Organization. So we are asking Turks and Caicos to please bear with us, be vigilant, listen to our warnings, adhere to our warnings with regards to travel into those areas that are affected, and so that we can continue to keep Turks and Caicos a safe destination and jurisdiction to live and do business. So I thank you, and I will ask the Minister of Health to also comment on the work that PAHO has been doing here in Turks and Caicos over the past week, and also Dr. Eichemans, and give her brief remarks with regards to what she has observed as an independent person coming to Turks and Caicos, as to how we are performing, what we are doing, what needs to be put in place, and how they will work with us to get it done. So thank you very much.
Thank you, Mr. Premier. Good afternoon, everyone. As Minister for Health and Human Services, I'm pleased to inform the general public about this week's visit and technical support received by the Ministry of Health and Human Services from our partners with Pan American Health Organization in order to support ongoing activities with preparations for the threat of Ebola and strengthening the TCI's response to dengue and chikungunya virus. The Pan American Health Organization, which is a partner of the Ministry of Health and Human Services, has provided technical support for many years to support the development of the health sector in our country. Dr. Eichemans, whom we have here with us today, the PAHO representative for the Bahamas and the Turks and Caicos, has provided technical assistance on this occasion by facilitating the visit of Mrs. Catherine Johnson, a consultant with PAHO who has a wealth of experience in the areas of environmental health, hospital infection control, epidemiology, and microbiology, to name but a few. Dr. Jerry Eichemans is the TCI's PAHO representative. She has also provided technical support to the government in organizing our response to Ebola and dengue, as well as chikungunya, in accordance with regional and international standards and guidelines. Ms. Johnson has worked closely over the last week with the Ministry of Health personnel in our environment department, like I told you earlier, our primary health department, the TCI hospitals, in addition to meeting with other key stakeholders, because we've had several meetings this week with key stakeholders in Providenciales and Grantor to support planning processes for the response of Ebola. Through this technical cooperation, I'm pleased to say that a draft Ebola preparedness and response plan for the Turks and Caicos has been developed. This will be used to guide further planning, including broader stakeholder consultations, so that TCI can meet the challenge faced by so many other countries in the region and the world. This framework will guide further activities which will be carried out by the Ministry of Health and Human Services, in addition to input from a broad range of stakeholders in the TCI. Further to this, Mrs. Johnson has also provided assistance to the departments to support ongoing activities to mitigate the impact of chikungunya and dengue on residents and visitors to the TCI. Through this assistance, additional support and training will be forthcoming through PAHO, vector control activities, and other activities within the EH or Environmental Health Department. We look forward to activities already in place to be strengthened. This will help us to mitigate the further spread of chikungunya and the further spread of dengue, which are both vector-borne illnesses. The Turks and Caicos Islands, like many other countries, are facing similar challenges. However, our government and the ministry are resilient in putting in place the necessary measures, including planning processes, resources, training, and procedures. With ongoing technical support from the government, PAHO, and other regional stakeholders, such as CAFA, in addition to support being provided from UK, measures are already in place and being put in place to protect the TCI from these threats and other health threats which may emerge in the future. So I would like to say on behalf of the government and the ministry, thank you to Dr. Eickerman and her team for the continued support and willingness to support the initiatives of the government of the Turks and Caicos Islands and the Ministry of Health at large, as well as Ms. Johnson, who shared her technical expertise with the health teams to further our goals, which are to work in the best interest of the health of our nation and to protect our thriving tourism-based economy from the threat of Ebola. Thank you.
Thank you. Good afternoon. It's a pleasure to be here again in Turks and Caicos, one of the two territories for which I serve as the Pan American Health Organization and the World Health Organization representative. And I would like to start by repeating the words of the Director General of the World Health Organization, Dr. Margaret Chan, who said last Wednesday at the closing of an international meeting on Ebola that the fear that is going on in the world around Ebola is entirely disproportionate with the threat it poses, except, of course, for the countries in West Africa where the threat of Ebola is real. As you know, at this point in time, there are 3 countries in West Africa where there is active transmission going on: Liberia, Guinea, and Sierra Leone. There was one 2-year-old child detected yesterday in Mali that has been isolated already. And what I think is really important is that 2 countries in Africa, Nigeria and Senegal, by taking the right public health measures, have controlled Ebola in a country. And these are not rich countries. These are countries that have used what they have with the intelligence they have to control Ebola. So this is good news for countries in the Caribbean. It means that if we do the right thing, we can control Ebola. So I want to repeat the words of the Premier saying there is no need for panic in the Turks and Caicos Islands when it comes to Ebola. Your health system, your preparedness will protect you from an outbreak of Ebola. What is important is to realize that it's always possible that a case of Ebola will come into the country. As long as we have in West Africa active transmission going on and thousands of cases have been detected there, as long as that happens and we do not control that, as an international community, there's always a chance that a case of Ebola will enter the United States, the Caribbean, Europe, etc. So for the World Health Organization, our main priority is to reduce and to control the outbreak at the source. And in order to do that, we have called on a group of international experts as part of the international health regulations, and they have called on countries in the world not to impose general travel bans nor general trade bans, because that will seriously hamper the efforts for the world to intervene appropriately in West Africa. And I do want to congratulate the Turks and Caicos Islands that so far they have not implemented a travel ban, because it is very important that we keep our focus on what is really important, which is sound public health. We have been here this week. Our team has been working here with the team in the Ministry of Health. We have visited hospitals, etc. I am very pleased with what I saw in terms of preparedness. As Premier says, it's very difficult for a country to say we are entirely prepared for everything. This is a moving situation. We have to watch at a daily basis what is happening around the world. We only have to look at our neighbors in the north, the United States of America. I do want to give that example. I think that the media there have been irresponsible. And I'm calling on the media in Turks and Caicos to play a role, to work with the government, with the official response, to give the correct information to the people in Turks and Caicos so that they can be alert, but not in panic. And I also want to say it's very difficult to control our social media. Anybody can post anything they want on social media, and we have the craziest stories going around on Facebook and Twitter, etc. But I encourage everybody to follow the advice and the information that is given officially through the government, and to ignore any information that is just posted by anybody for whatever reason. And I do very much congratulate you and invite you as the press of the Turks and Caicos to be responsible press and to help in keeping the country safe. This week, as I said, we have visited hospitals, etc. We are sufficiently satisfied with what we have seen. This is work in progress. Of course, there will be some extra steps that are needed, but I think Turks and Caicos are on the right track in being prepared and for any eventual case of Ebola that might land on the shores of the Turks and Caicos Islands. Congratulations, Premier, your team, and everybody in Turks and Caicos who have been doing that, and I encourage further strengthening, of course, of your activities. The national plan that we have presented this morning together between the Ministry of Health and PAHO will help to put all the elements of the puzzle together. As we all know, a situation like Ebola poses the need for all sectors of the government and also for the entire society to work together to make sure that we have all our policies and our plans in place. So thank you very much for this opportunity.
Questions for her before we move the mic?
Open the floor for questions related to our Ebola preparedness and response before we go into the next section of the post-cabinet.
Anyone can answer this. You said that the TCI is sufficiently satisfied with the preparedness. What areas do you see that can be boosted?
I think in general, it's very important to finalize the plan and put everything in writing and so that we go step by step through. If any scenario would happen, what are we going to do? And this is a challenge for all countries, but I think the elements of the puzzle are there. It's now a question of putting it all together so that we are collectively satisfied and ready that everything is being done as it should be done.
You mentioned earlier, Premier, about, if I'm mistaken, the law or an ordinance to subject all persons to screening or quarantine. Can you elaborate on that? I'm not too sure. Is it's going to be a new law or something put in place where a person suspected of Ebola?
No,
Does this have to go through a law process?
No, that was actually put in place over a week ago. We're under the Public and Environmental Ordinance. The governor, on the advice of the Public and Environmental Board in Cabinet, approved for public health order with regards to Ebola to be developed. And that order basically stated that persons who have traveled to or have been in contact with persons infected with Ebola from those countries shall be subject to questioning, screening, and or clinical examination or whatever other examination and quarantine if necessary as part of the Ebola control response measures.
How satisfied are we in terms of the resources that we have on the ground? I mean, because if worst case scenario, we get a case and we're worried about transmission and other things we're getting, do we have enough resources to deal with that?
At the moment, we don't have enough resources, and that is the reason why Cabinet has made provisions for financial resources, and we are continuing to get more and more staffing resources on hand. But what we have now, we're able to effectively deal with issues at the border with regard to screening and surveillance within the public. And as time goes on, within the next couple of days, we'll recruit more and more staff resources that will become available, more and more supplies. We actually had to break bulk of our supplies, such as getting thermometers in stages, as well as getting PPEs in stages to enable us to have at least the basic minimum in country to respond to immediate threats, and then to beef up the additional resources if necessary. PAHO will also tell you that they have, as part of their response plan, that if a country like Turks and Caicos was to detect one case of Ebola, they have an action plan that allows for the mobilization of supplies like PPEs and probably manpower as well to come to our assistance in Turks and Caicos within a matter of days. And so we don't always have to have our full level of preparedness on the ground. As long as I think the rule is to be prepared to deal with a situation for at least 3 days in country, and then because you'll then get your cooperation from organizations like PAHO to beef up your response.
Has there been any sessions on the education aspect of it? Because when you hear of doctors and nurses at hospitals in America getting it wrong, how much of your attention is being placed into educating nurses and doctors about how the virus actually works and using these resources?
Yeah, we had a series of education sessions with doctors, nurses, as well as other frontline staff. We've even educated staff at the hotel and tourism sector. The hospital section had a major session yesterday where they went through and will continue to go through, because this is ongoing process, such as PPE, how you use it, how you put it on, how you take it off. These things are ongoing in dealing with the virus. Nothing, however, you do means that no one will ever get infected because of lack of education. Sometimes you'll have persons who probably don't abide by protocol, but these are experiences that we learn from, and I hope that we can learn from the mistakes of other countries before we ourselves make the same mistakes.
When will the
simple
public
supplies
education campaigns begin? Public education campaign.
The public education campaign has already begun, and they are focusing first of all on the frontline staff, so the immigrations, customs, airport security, airline cleaning staff, other healthcare provider staff, fire persons, persons in the various ports of entry. So they're focusing on the frontline staff. There is increasing messages that will go out to the public, and those will be ramped up even more into posters, and we're getting even more posters and such being printed now as we speak to place in more public places like the airports and the various ports of entries and supermarkets, etc.
I'm sure you may have heard or even seen some of the posts on social media regarding the government's decision not to impose a travel ban. What's the reason behind not imposing when people around us are imposing?
We should lead.
Well, you always follow individuals, and I'm a public health practitioner, first and foremost. And as a public health practitioner, what Dr. Eicherman stated earlier with regards to the belief of PAHO, WHO, in international health regulations, travel ban as a public health approach to disease prevention and control, it is not the right approach to safeguard a country, and it does not prevent you from getting Ebola. And so we thought it necessary to do the first and foremost good public health practice, like countries maybe like the Bahamas and other countries are doing as a first step and measure. If you find that we're having challenges with that approach, then you can continue to keep under evaluation your decision with regards to absolute travel ban, because travel bans themselves have their own implications. But I will never say never to a travel ban, but I will have to put on my political hat to do so, because it's more of a political approach and play to the minds of people more so than a public health approach. And we need to consider the political implication, the other economic implications of placing a travel ban or not as part of your decision making. And so from time to time, I will probably have to consider both, because I'm wearing both hats now as both a public health practitioner as well as a politician.
Dr. Ackerman has spoken earlier, and she stressed on the emotions, and pretty much touched on that too, about persons saying, well, it's chaotic. Basically, it's very, very chaotic. Now, I just want to get from maybe you, Mr. Premier. Persons may travel to Africa, not necessarily Ebola-affected areas, and they will be coming back in the TCI. What education measures are in place for the persons at the point of entry to say, okay, you didn't go to an Ebola area, you're accepted? What's education like that?
From the point of entry where?
From a particular country in Africa that has no Ebola. When they reach Providenciales.
Say South Africa to Provo.
Well,
no case in South Africa.
I don't know if you mean at the point of entry in terms of educating individuals, what they see here?
The individual at the airport, like immigration, customs, thereabouts, those people. What the education say? Somebody went to Africa, but not necessarily any.
Well, what we are implementing at the moment, and as I said, should be fully implemented by tomorrow, is a questionnaire, and the questionnaire is Ebola-specific questionnaire. It's almost like an additional customs form, and you have some the information that's contained on that asks very detailed information about your travel, your degree of contact, if not with persons who might have been possibly affected with Ebola, and things like fever, if you had any symptoms that suggested Ebola, and what will happen to you upon arrival in Turks and Caicos if that was to be the case. And so that in itself, from the time you board a flight anywhere outside of Turks and Caicos, you are subjected to that. And that will be fully implemented as of tomorrow. But at the moment, what is happening as part of the screening exercise, everyone that comes in is getting their temperature done, as well as asked those same questions that are on the questionnaire, and to be educated themselves about it.
I believe at the last Ministry of Health press conference, the figures were around like $250,000 for the Ebola preparedness and the other health issues, I stand to be corrected, but can you say what the additional increase will be?
Well, so far we have allocated in excess of $400,000 to our Ebola, combined Ebola, chikungunya, and dengue response expenditure, and that actually formed part of our supplementary budget as well. But we can have access to it even in advance of the approval of the supplementary budget, because it's part of the contingency or emergency funding that is being made available to the ministry.
Have you guys decided on where the quarantine zones will be, or is it just the isolation rooms at the hospital? The hospital themselves are preparing the various rooms that they will consider isolation rooms, as well as the ministry have contracted certain the containers that will be placed in the hospital compound for the isolation and treatment of individuals on that hospital compound. As in shipment containers?
As in containers modified specifically for the purpose.
Would it be possible, I guess this is part of the media op, I've seen some pictures of the equipment that has been brought in from the Ministry of Health. Would it be possible to get some video of that?
We could arrange at some point in time for demonstration.
Every flight that lands in Turks and Caicos, we use that equipment. And once you have Airports Authority access, we can get you some video of it.
Airport Authority said it was Ministry of Health we have to talk to.
That's fine.
Well, what I would like for you to do, and invite you during one of the days to observe the screening procedures at the airport, to see where to go through the questions are asked, and because you are part of the educating the public as well as to what is taking place and what to expect in coming back to the country, and we, with regards to the PPEs, there are different levels of personal protective equipment. As I mentioned to my staff, there's no need for us to put in spacesuit type with a respirator to meet persons at the airport entry. That's not the case. The most that is needed is simple glove and mask, and probably a very regular gown, if you need any, to meet and greet persons or take a temperature. But as you move up the scale of evaluation, like in the medical room, then I expect for them to have a different level of equipment, not even self to the level where you expect if you have an Ebola patient. And then when you're treating an Ebola patient, that is when you have the maximum level of PPE equipment according to the new CDC guidelines that we will have.
Do you have any figures on how many tourists, people that travel from Africa into the country?
No, I'll have to get those figures for you, but it's not many tourists from a tourist perspective, no.
I know you spoke about resources earlier. We usually hear the phrase that chlorine is Ebola's kryptonite. How are we stocking up on that?
That?
Chlorine.
Bleach.
Ebola kryptonite. Yeah. Most of all the cleaning here.
I don't understand the question.
You usually hear the phrase, I mean, whenever you're watching a lot of the documentaries
Clean,
on
clean,
Ebola,
clean.
with the PPIs, what they do is, it's critical chlorine, you have to wash it off, that's a part of protocol. I'm asking you guys, are we stocking up on that as well? Because we see countries in Africa running
We are procuring them. All of those form part of our procurement plan.
The
Yeah.
full kit. Right. I think Ebola's had its time.
Premier, has the following exercises, have they started around the islands? Have they already started?
Yes, that we started.
Yeah.
No, no.
Any other questions?
All right. Another question. Thank you very much for that particular
I do have
section.
one last question. Will the public education campaigns, will there be any sort of TV and radio ads, or will it just be print?
Absolutely.
Yeah.
Absolutely.
Yeah.
When can we see those?
Yeah.
Shortly, I'm hoping by next week, we can have TV and radio ads, but we've already begun the printed matter, we've already started the social media. So we will hopefully be able to get TV and radio by next week.
Okay.
Yes.
We started working on it.
Yes,
Yeah.
yes, it's
Started
already,
working on
it's
it.
already
Yeah.
been formatted,
Yeah.
it's just a matter of getting it there to you.
Yeah.
For now,
Yeah.
on social media.
All right. Thank you very much for the question related to Ebola, and I'll now move on to the other segment.